Yeah. No, I'm truly grateful for everything that you're saying so far. It's actually really, really fascinating. There was something that I wanted to quickly mention as well. Was a book that you spoke about in one of the podcasts I watched. It was called Brain Energy. You're probably familiar with it, or you probably remember it rather, by Christopher Palmer. Does that ring any bells?
No, no, that's not a book that I've read, I don't believe.
Huh. Okay. It was definitely, I definitely discovered it by a podcast that you were in. Maybe it was the host that was
Yeah,
talking about
correct.
it.
Yes, correct.
But it was, so his theory, Christopher Palmer, is actually very, very fascinating. So he's a psychiatrist, a Harvard medical from Harvard Medical School, and so his theory is that uh, mental health issues are caused by they're a metabolic issue. I believe I'm getting the terminology correct. In other words, so the cells in the brain don't have the energy or the function. Um, so yeah, they don't have the energy to function properly, which causes the mental health issues. I
Let me
don't know if
see
you're
this. I
familiar
have
with this
another
theory or
article
if you
just
hear
written.
much about this.
His particular theory, no, but it sounds like what I just wrote would fit in perfectly with that. I wrote an article that says schizophrenia is chronic encephalitis and niacin cures it. And all the documentation is there.
I've
And
heard it before. Yeah.
and it's inflammation. What is inflammation? Inflammation is oxidative stress. We're coming back to the whole thing. It's just what
Yeah.
about a certain process gets it? Well, when you're very low on niacin, you don't have anything close to the substrate that you need for the first stage of that 4-stage electron transport chain. And as soon as you start taking niacin or niacinamide, the NAD levels rise up in your brain and you start producing more energy, more ATP. And let me tell you, I don't care what the disease is, what the pathology is, nothing. If you increase ATP production inside a cell, it's going to get better or it's going to be completely cured. One of the two. Okay. So, and I mean, this dramatically applies to schizophrenia, but depression, uh, manic depression, cognitive problems, the whole ball of wax. Okay. We tend not to think of mental disorders as having physical basis, but obviously it has to, just because you have a combination of cells that are producing something as exotic as a thought doesn't mean that they still don't have physiological principles that have to
Right.
keep them well so that they can do whatever this glorious process is of turning something physical into something ethereal. But
I mean,
no,
it
I mean,
makes
niacin,
perfect sense, doesn't it? Really, when you think of it, like if the cells in the brain aren't functioning to their highest capability, then obviously there's going to be some kind of impairment going on in the brain, right? And that would manifest in your thoughts, because that's where our thoughts are. So it just makes sense, really, when you think about it.
there's a something that's not used a lot, but is very effective in all walks of life, but especially in medicine, is common sense.
Common
And
sense.
it's also
I knew you were going to say
it's
that.
also having an open mind. So many people, I think we're all subject to it to one degree or another, but some people severely, which is you have to be open to everything. And so many people will just immediately shut themselves down if what you're suggesting or proposing is going to change the way they do things. I mean, tell me what you want, but don't mess up my lifestyle, my protocol, my way of living, my generation of income, this, that, or the other. So
Cognitive
first and
dissonance is the
foremost,
word,
we
isn't
need people to be objective scientific thinkers who, and I will be judgmental here, care about people. I mean, after this pandemic, if anybody thinks the medical system as a whole has the best interest of the patients in mind, I don't know what planet they're living on.
it? Yeah, it makes you wonder, doesn't it, Dr. Levy, like how people could still put their blind trust in a
In
system
many
like that.
ways, long term, that might be the biggest positive impact of the pandemic is it's finally getting a large portion of the public to no longer trust the fraud and evil institution called modern medicine.